Last week on the program, I raised concerns about a push to encourage doctors to keep consultations for medical cannabis prescriptions to as short as 7 minutes. Well, now peak medical bodies in Queensland are calling for tougher restrictions following an increase in the number of patients rocking up to emergency departments with psychosis symptoms after being prescribed medical cannabis. The Australian Medical Association Queensland, the Queensland branch of the Royal Australian and New Zealand College of Psychiatrists, the Pharmacy Guild of Australia, they've all written to the TGA to express their concerns. This letter states patients, particularly those with psychotic illnesses, are suffering significant adverse health outcomes from inappropriate prescribing and use of products with highly potent concentrations of THC. I'm not going to read the whole thing out for you. You can read it on the screen because, Kel, I don't want to incur your wrath for mispronouncing it. But clearly we have a problem here. I'm not opposed to the use of medical cannabis where it is appropriate, but it is very clear that this is a system that is open to abuse, and from what doctors are saying, it is being abused.
Yeah, well, look at it. It's psychosis. Cannabis can cause psychosis, but you've got to have a hell of a lot of the stuff. So these are people who've been getting it and getting a lot of it for a long time. Obviously, the people in the weed community, the weed heads, know the go-to doctors, and they're exchanging names and they're going to the go-to doctors. This is the age of the computer. This is the age when it's possible to know who is writing all of these scripts. And some of them possibly need to be struck off because what they're doing is irresponsible. I interviewed a doctor who specialised in palliative care, and he said in hospices, medicalised cannabis can be really useful. He said people don't understand. Proper medical cannabis, no one gets a high. They don't get a high. It just helps with pain control. You've got someone who's at the end of life and they've got pain which is hard to control. Medical cannabis can help. There's a place for it. But there's not a place for 167,000 scripts.
Yeah.
Right? So this is what we have computers for, and someone at the Department of Health hasn't turned on their computer and said, who is writing all of these scripts? There will be a list of names. There will be, everyone knows who's looking around. There are some doctors you go to if you want time off from work. You know, you can get the chit. That can happen. And these people clearly know who you can go to get the cannabis script. So you find them on the computer and you get them out of the system because they are the problem, not the users, those doctors who are abusing their position as GPs by just writing out scripts when they'd probably beat the 7-minute limit. 3.5 minute consultation, here's your script, off you go.
I think we're missing the bigger problem, though, around the cannabis. I mean, we can argue till the cows come home whether it's good or bad, whether it should be medicinal or recreational. I think anything the government says is probably not good for you is probably good for you in a way. I'm not saying that I agree with recreational cannabis use, but there definitely, like you said, has been a lot of cases, particularly with palliative care, where you can see, improvement of life for certain people. But I think that this is really scary, though. As a nation, Australians, and we should be terrified of how physically, how emotionally and how spiritually sick we are. Look how many people are going to seek help. Like, I think,
and they're all in Queensland. Why is it happening?
I'm surprised, don't have the Victorian numbers.
I think the other thing is, though, and is the capacity. I think once you've got a sort of industrial scale cannabis industry, and especially now once you've got the capacity to produce synthetic drugs, and I don't know if these are synthetic or not, but the concentrations that you can get, if you're just, as Kel said, your average sort of weed head, wavy gravy is, is chuffing on a few joints of, leaf or your organic head or whatever from, good old Adelaide Gold or whatever it is the kids do now. I'm very out of touch. That's one thing. But if you've got stuff that can actually be genetically engineered to have super high levels of tetrahydrocannabinol, then...
Well done.
Here we go.
Showing off.
Josie, showing off.
I don't know where I got all this inside knowledge from. Many, many years ago. But I think that is the problem. And so you can have people who think that they've got a certain level of resistance to cannabis, and even if they're pulling the wool over their eyes and they're just using it recreationally or whatever, but then they get something like this that is super, super strong because it's been industrially conditioned to be as strong as possible and efficient as possible, because that's what you do if you're in industry. And then you have that, and that's when suddenly your mind is blown because you're having a super, super strong concentrated dose of something you thought you were going to. It's the same with all other drugs, you know, heroin, that's why you have overdoses.
A lot of the time they get cannabis and lace it with another drug when they don't get high off it, and then you get addicted to the other drugs, how drug dealers get kids hooked especially.
Yeah, so I reckon that might be the secret, the little secret
But we live in a society where we overdiagnose people. Every second Gen Zer has some disorder, and we also, we don't only overdiagnose, we overprescribe. It's not just cannabis, it's all pharma. And I think, like I said, this is a symptom of a far bigger problem. And I think if we address the bigger problem, the cannabis thing probably wouldn't be as big of an issue.
They should do what they did in previous generations and just get drunk.
There have got to be doctors
Yeah, I agree.
that are irresponsible.
You're correct.
That's right. So and the computer will tell you who they are. You can do something about them.
Yeah, and something should definitely be done about that.